question. Yes. Okay, so if you have read and understood, considering its surgical pathology station, kindly tell me, after reading the STEM, what are the differential diagnoses that you will consider for this patient?
So here my provisional diagnosis will be familial adenomatous polyposis.
Good.
And differential diagnosis can be colon cancer or like other genetical problem. It could be what we call this Lynch syndrome and maybe
Okay.
hematomas polyp. Yeah,
How would you
Pearce-Jaeger syndrome.
confirm? How would you confirm your diagnosis?
Okay, so we have to take biopsy and then
Okay.
we can send for histopathology. So that one will tell us about the types
She
of polyp.
has already
And
undergone colonoscopy and she says she has a strong family history. So how frequently patients with strong family history be asked to repeat or go through the colonoscopies or surveillance management?
okay, so as she has a positive family history, so
Yes.
it should be started from as the age of 12 years.
Okay.
And then for her, now she has multiple polyps, so it should
Yes.
be done maybe every yearly.
Okay. Every yearly or more frequent? Okay, what kind of management can we offer to her?
So for her, though is not very sure is it a Fap, but if it's a Fap, she has a multiple polyps. The largest one is 7 millimeter,
Yes.
ulcerated, and she has a positive family history. Father
Yes.
died of cancer at early age, so we can offer her at 25 years of age pan-proctocolectomy and end ileostomy.
Okay. You said she has strong family history. So what are the genes which are involved in her condition?
So it will be APC gene, and then
Yes.
maybe like for other symptom.
What is the function of KRAS gene
Yes, KRAS
and P53?
and P53, yes. So KRAS is a what
It
we
works
call
for
KRAS.
mutation or dysplasia. And P53?
P53 is a tumor
gene.
suppressor
Yes.
gene. Yes.
Yes.
So it's a tumor suppressor gene. If proliferation of this gene might cause cancer. I mean, loss of P53 might cause adenocarcinoma.
Okay, can you tell me, considering the colon, which carcinoma is most common?
So adenocarcinoma is the most
common one. All right. How would you categorize the carcinoma of the colons? What classification method can be used?
Okay, so we can use mostly Duke's classification and
Yes.
TNMS as well.
Okay. Can you explain or?
So Duke's classification, it can be Duke's A, B1, B2, C1, C2, and D. So A, there is no tumor, or maybe tumor is only invade the mucous membrane and not beyond the muscularis mucosa. And type B1, it will be up to muscularis mucosa, but not the serosa. And type B2, it will involve the serosa as well. C1, it will involve the muscularis mucosa and local lymph node, maybe 1 to 3. And C3, if invade the serosa and if lymph node is more than 4. And D is distal metastasis.
Good. Can you mention few extracolonic FAP?
So extracolonic, it has maybe osteoid osteoma, and then maybe okay, you mean it can be in the stomach, it can be even in the duodenum?
Yeah. Basically, there can be tumor can be of all locations: ectodermal, mesodermal, desmoid tumor, fibrosarcoma.
Yes, sebaceous
These are
cyst,
endodermal.
desmoid
Yes.
tumor, and
Yes.
osteoid osteoma
This
or
patient
mandibular osteoma.
also is a known case of endometriosis. Can you define the term, please?
So endometriosis, presence of uterine endometrial tissue other than the uterus, or ectopic site to the uterus.
Okay. Can you tell me why the patient feels so much pain? Patient with the endometriosis, why do they?
So okay, during menstruation,
Yes.
menstrual phase, maybe the patient might bleed from those endometrial tissue. So that's why it can be painful.
Actually, their explanation is little different. Fibrosis can occur at the site of lesion. And in case of this, there is formation of adhesion that leads to subsequent obstruction, and that leads to pain formation. Anyway, can you please tell me, all right, if we can describe this, what are you looking at? Please, can you describe the image?
Okay, so here we can see more than 100 of different sizes of polyp.
Very good.
And some of them may be ulcerated.
Okay.
So my professional diagnosis, it can be a...
What else do you see? What is this yellow? What is this glistening? Yellow glistening, what could that be? So when you're describing, you've described the polyps, some can be ulcerated as well, and this glistening yellow could be?
The membrane.
Why membrane? Which colon could that be? And this yellow could be? And what is this? But you see this? Okay. What else can you? What are the lifestyle changes that you can advise to this patient, which can reduce the risk of colon cancer?
So we can ask the patient to take more fibrous food, less fatty food, stop smoking, reduce alcohol.
Yes. Right. Anything else? Can you define the term dysplasia?
So dysplasia is a disorder of the cellular development where increased mitosis and pleomorphism.
Very good. That can invade the basement membrane.
That can invade the basement membrane.
Very good. Okay.
No, that cannot. I think that cannot without
Without
ability
the ability to invade. Yes.
invade the
Can
basement membrane. Yes.
Good. That cannot. Because if it will invade the basement membrane, it will not be dysplasia, right? It will be metastasis.
It will be metaplasia or malignancy.
Malignancy. Good. Thank you.